My name is Amanda, and I will be handling today's talk. For today's talk, we will be discussing about myths and facts about diabetes. So I'll be touching on the common myths and facts about diabetes and recap on the information given so far in the past 2 sessions. Last but not least, we will have a question and answer session where I can help to answer your question as much as possible. So what do you know about diabetes? What are the facts and myths about diabetes?
English.
There are many misconceptions about diabetes, and now let us discuss and have a better understanding. So first, can anyone tell me if this statement is a myth or a fact? Diabetes is contagious. You need to be careful. You may wish to unmute yourself or write in the chat to tell me if this statement is a fact or a myth. Can anyone tell me is a fact or a myth?
Myth.
Yes, it's a myth. So diabetes is not contagious. You can't catch it from another person. Although researchers think that getting type 1 diabetes may be triggered by something in the environment, like a virus, but most people can get type 1 diabetes have inherited genes that make them more susceptible to the disease. Otherwise, you can't get diabetes from anybody. So next, diabetes is caused by eating too much sweet food. Is this a fact or a myth? Is this true or false? Can anyone tell me if it's true or false?
Works both ways. Yes.
So actually this is a myth. It is not necessary that eating too much street food will cause diabetes. So to recap, diabetes is a chronic disease that is marked by high blood glucose level, which result from the body inability to produce insulin or respond to it efficiently. So insulin is responsible for reducing blood glucose level in the body when it is too high. Although eating sweet food may not cause diabetes, but a diet with high sugar and fat can lead to obesity. So this will increase the risk of developing type 2 diabetes. Okay, is everyone following? So can anyone tell me if this third statement, diabetes can be cured, is this true or false? You can write in the chat or you can unmute yourself to tell me whether this is a fact or a myth.
False.
Yes, so this is a myth. Diabetes is a chronic disease with no cure. However, the condition can be managed to prevent complications from arising. So next statement, people that take insulin have more serious diabetes than those on oral medication. So do you think this is true or false? Can anyone tell me?
Maybe I give you a Amanda. Hello everyone who has just joined us for this talk. Today's session is a bit different. So it's not more of just my the nurse that will be sharing. So it's more of a Q&A interactions between yourself and the nurse. So if you can kindly help us actually turn on your mic so that you can actually help to take part in this participation. That they will be more fun in this way as well. So that there's no right or wrong answer. So feel free to answer. Then that's where we actually all learn together as well. Thank you. Okay, thank you, Amanda.
Thank you, Felicia. Hi. For those who just came in, so this is the talk about diabetes. So we will be discussing about the myths and facts about diabetes. So it's more of a like first say it's more of a question. So I will ask this question and you can tell me if this is a fact or a myth. Okay, so this statement, people that take insulin have more serious diabetes than those on oral medication. So anyone on the ground can tell me if this is a myth or a fact. What do you think?
It's a fact.
So, yeah, so this is a myth actually. So patients with type 1 diabetes are not able to produce insulin due to an immune disorder affecting the pancreas. So therefore, oral medication that stimulate the production of insulin by the pancreas are not suitable for this patient. So these patients with type 1 diabetes require insulin injection to control their blood sugar level. But for those with type 2 diabetes, initial treatment may involve only oral medication or insulin injection. Sometimes may require a combination of both treatment to obtain optimal control of their blood glucose level. So this is not true that people who take insulin has more serious diabetes than those on oral medication only. So the next question. Amputation cannot be avoided for diabetes patient. Can anyone tell me if this is a fact or a myth?
It cannot be avoided for diabetes. It's a fact.
It's a fact? No, it's a myth.
It's a
So
myth.
when only poorly controlled, diabetes can lead to blood vessel damage in the long run, which leads to complications like foot ulcer and amputation, nerve damage, blindness, kidney failure, heart disease, and even stroke. So these complications are avoidable if your diabetes is properly managed. So for this reason, this is important for diabetic patients to go for regular screening of their feet, your eyes, your kidneys to monitor for these mentioned above complications. So it can be avoided if you manage your diabetes well. Okay, the next one. People with diabetes should avoid carbohydrates. So carbohydrates in another layman term would be just glucose, sugar glucose lah. So what do you think? Should people with diabetes avoid carbohydrates totally?
Not totally.
Yes, yeah, correct. So carbohydrates which may increase your blood sugar level as they are broken down in basic sugars to provide energy for the body. But however, carbohydrates are present in a variety of food, including your fruits, your vegetables, your rice. So these are important sources of nutrients for yourself to produce energy. So it might not be practical to totally avoid carbohydrates because you need energy, but do consult a dietitian who can offer advice on a suitable diet for diabetes patients. Okay, so the next one. People with diabetes can eat snacks or candies with no added sugar or that are diabetic friendly. Is this true or false?
People with diabetes can eat snack or candy with no added sugar. True.
Okay, so this is actually false. Snacks and candies with no added sugar, they are made for diabetic patients, are preferred alternatives to regular snacks because these contain less sugar. But then the sugar in these products are replaced by artificial sweeteners. So these snacks or candies tend to be of low nutritional value but can be high in fats. So it will be a good practice to look at the content of your product before eating them or to take them in moderation. So the ADA actually requires sugar-free products to contain no more than 0.5 gram of sugar per 100 gram of food or 100 ml of water. So these usually contain less sugar than the other similar products, but they do contain other artificial sweeteners like sorbitol. So food that are labeled no added sugar or they are suitable for diabetics can be misleading because they have naturally occurring sugars or fats that is not taken into consideration. So it is important that to read the nutritional value information for any type of food before you buy and eat them. So products like fruit juice, they normally would say no added sugar, but they can still raise your blood sugar level as quickly as other sugary drinks because they contain natural fruit sugar. So snacks that use artificial sweeteners can also be high in fat content, can be high in calories, even though they say that might be low in sugar. So these products can affect your blood sugar control and your excessive gain, which also is a major risk factor for your diabetes. So to summarize, you can eat all these snacks, but in moderation, and you must check whether if they are high in fats and all this stuff because to control your weight as well. Okay, the next question. I can eat as many fruits and it will not affect my diet condition because fruits are healthy. Is this fact or myth? Can anyone tell me if a diabetic patient can eat as many fruits?
No.
No.
Yeah, correct. So it's a myth. Fruits do contain many vitamins, minerals, and fiber. So it's great to include them in your meals. But then the fruits also contain natural sugars and carbohydrates. So you need to stick to your recommended portion, which is 2 portions daily. You need to spread out these 2 portions or eat them between meals to prevent sudden spike in sugar and help to control your blood sugar. Pick the whole fresh fruit alone instead of the juice or the dried or the canned fruits. The canned ones and the juice one will contain added sugar and they may increase your blood sugar. So to emphasize, they are important and because they are packed with vitamins, minerals, and fiber, so you need to eat them. But just do watch out your food intake. Have 2 servings per day, not more than 1 serving at a time. Have 1 serving as a snack. You can choose those with fruits with fiber. For example, your apple, your pear, all these fruits. Then you can eat your fruits with your meal and you can cut down on your staples and like your rice, noodles, potato, and bread. So choose fruits and fruit over fruit juice because fruit juice have high sugar in content. So what exactly is 1 serving? I say you have to eat 2 servings per day, but as seen from the picture, 1 serving of fruit can be 1 small apple or 1 pear or 1 small orange, or it can be 1 medium banana, or you can eat 10 grapes as 1 serving, or even 1 wedge of papaya or watermelon. So do contain your meal with servings of fruits per day. Spread it out as all these contains vitamins, minerals, antioxidants. Okay. So the next one. High blood sugar levels are normal for some people, but they are not a sign of diabetes.
Yeah, not a sign.
Is this true?
High blood sugar level are normal. But not a sign.
Is this a fact or a myth?
Myth.
Yes. So certain conditions like illness or stress and certain medication can temporarily cause high blood sugar level in people without diabetes. But high blood sugar level for long periods of time are never normal. People who have higher than normal blood sugar or sugar in their urine should be checked for diabetes by a doctor. Okay, the next question. People with diabetes can feel whether their blood sugar levels are high or low. Is this a fact or a myth?
Miss.
It's a myth, correct. So although someone with diabetes feel physical symptoms such as your increased thirst, weakness, or fatigue, if the blood sugar levels are high or low, the only way for sure to check the levels is to test them. So for example, because blood sugar levels have to be very high to cause symptoms, a person who is not testing regularly may be having blood sugar levels high enough to damage your own body without realizing it. So you do have to check your blood sugar levels regularly. Okay, the next one. All people with diabetes can or need to take insulin. Is this a fact or a myth?
The fact.
Okay, it's a myth.
It's a myth.
So yeah, so all people with type 1 diabetes have to take insulin because their pancreas themselves, they don't even insulin anymore. So that's why they need to take. But some, but not all people with type 2 diabetes have to take insulin because they can use pills or diet to manage their own blood sugar levels. Okay, the next one will be insulin cures diabetes. Is this a fact or a myth?
Insulin cure diabetes. Yes, it's a fact.
So it's a myth. Taking insulin helps to manage the diabetes, but it does not cure it.
That's not cure.
So insulin helps to get the glucose out of the bloodstream into the cell where it can be used for energy. So this will keep the blood sugar level under control, but it does not correct the root cause. So as you can see this picture, it demonstrates how insulin therapy works in the body. When you inject insulin into your body, it will allow glucose, which is your sugar, into your body cell. So hence, it will help to improve your blood sugar and prevent or delay complication that is caused by your diabetes. However, the injection may also cause hypoglycemia, which is low blood sugar, and potential weight gain. So you need to watch out for these complications as well. Okay, so the next one, tablets or pills for diabetes are a form of insulin. Is this true or false?
True.
Okay, so diabetes medicine taken by the mouth are not a form of insulin. Insulin is a protein that can be broken down or destroyed by the acid and digestive enzymes in your stomach and intestine if you swallow them. So currently, there's no practical way to deliver your insulin injection except through your injections. You cannot take through mouth. So although researchers are working on ways to give insulin by the mouth or the nose or inhale it in your lungs, but some people, for now, with type 2 diabetes, can only take pills and tablets to help the body to make more insulin or use the insulin that it makes more effectively. But the pills cannot help people with type 1 diabetes because they themselves are no longer making insulin anymore. So this picture, there are many different types of medication that might be prescribed for you. So you cannot compare with one and another. Different medications have different actions. You can always check with your doctor and get more information. Medication works in different ways and on different body parts. The most important take-home message is that you have to take your medication as prescribed. Some of the lines can include: take your medication regularly at the correct timing. Those who are pregnant or plan to get pregnant, please consult your doctor before taking your medication. If you're experiencing persistent symptoms of hypoglycemia, which is low blood sugar, please consult your doctor. If you miss a dose, take it as soon as you remember. If it is near the time for the next dose, you may wish to skip the missed dose, but do remember to take it regularly at all the correct timings. So inform your healthcare professional if you are taking metformin. Metformin is another diabetic drug before you go for any scans or procedures. You need to eat your meals regularly to prevent low blood sugar when you take your medication, and also avoid taking alcohol, your medication. So the next statement, having to take more insulin means my diabetes is getting worse. Is this a fact or a myth?
Yes.
Okay, so this is a myth.
Yeah.
Insulin doses need to continuously adjusted to help your blood sugar level in a healthy range. There are many factors that will affect your blood sugar. So example, your diet, your exercise, and the time of the day. So insulin doses may need to change over time. At the time of your diagnosis, the pancreas may still be making some insulin, so less injected insulin may be needed. So as time progresses, your pancreas will make less and less insulin. So more insulin needs to be given by injection to keep your blood sugar in a healthy range. So some factors like how fast the kids are growing, whether the kids are undergoing puberty, or how much eat, how much a person eat, or how active they are. All these factors will affect the amount of insulin that you need per day. Okay, so poorly controlled diabetes can lead to food complication. Is this a fact or a myth?
Fact.
It's a fact, yes, it's true. So some of the food complications resulting from diabetes: first, nerve damage. It can make your foot feel numb and change its shape, increasing your risk of getting calluses and ulcers. And secondly, extreme poor blood circulation caused by your diabetes can cause wound to heal poorly. So in worst case scenario, an amputation may be needed to save your life. But like I said before, all these can be avoided if you control your diabetes well. So let me tell you some of the good food practices. So you need to monitor your feet every day. You need to watch out for blisters, wounds, corns, calluses, or your toenail abnormality. And you need to see if there are any illness, swelling, bruises, or increased warmth. And make sure you see a doctor to treat all your food abnormality. So how do you maintain? You need to maintain good food care and hygiene by cleaning your feet daily with mouth soap and water. You need to thoroughly between each toe. You need to use a stone or foot file to gently remove your hard skin and avoid cut nails too short. Cut them straight and across, and you can file the corners. Then you need to moisturize regularly. You need to avoid using harsh soap, and you need to apply your moisturizer, but not in between each toe, just on your general foot area. And avoid scratching your skin. because it might lead to wound or a bleeding. So you need to wear your well-fitting shoes and covered footwear. Then home sandals are recommended because they are covered and they are well-fitting. Then you can check and remove any stone or sharp objects in the shoes before wearing them, because these may cause small wounds as well. So if you have a small wound, please apply your simple first aid for the small wound. Clean them with saline and before applying antiseptic cream and covering with a plaster. So if you have a wound and the wound shows no improvement after 2 days or it worsened, please seek your medical help. If signs of infection such as redness, swelling, creased pain got past, if you have a fever and the wound starts to smell, please seek your doctors as soon as possible. So let's talk about what makes a good shoe. Remember that you have to choose socks with tops that are not too tight. Wear a pair of cotton socks or stockings with your shoe at all times. Wear well-fitted covered shoes. Check and remove any stone sharp objects inside your shoe before wearing them. Use suitable footwear for different activities. Like if you want to exercise, you can use your sport shoes. If you want to do daily shopping, you can use sandals or sport shoes, or use barefoot slippers with cushioning at home. You don't need to get the exact shoes, but these principles that I mentioned before are important before we choose a shoe for yourself. Okay, so to summarize everything that I said so far, you can still live well with diabetes. With the right diet, adequate exercises, professional medical advice, and treatment, you can still enjoy a healthy and happy lifestyle even with diabetes. You may wish to follow the guideline of My Healthy Plate, the picture on the right hand side, to guide you as you prepare your meal. So you need to have 2 servings of fruits and vegetables, 1 serving of brown rice and wholemeal bread, and 1 serving of meat and others for your healthy plate. So these are the links for the recommended healthy recipe. There is English version and there is the Mandarin version. So these are taken from the Health Hub, which you can use to cook your healthy meal for the day. Has everyone got the link? Everyone got the link? I move on now. Anyone still want to stay on this page? Okay, now I move on now. So the next slide is a video to show you 7 easy exercises you can do at home. So I will show you the 7 simple steps. Hold on for a while. Can everyone see my video?
Yes, can see.
Yes.
Okay. Can everyone hear?
No,
Cannot hear.
the sound. I think when you share, you have to click on the share with your computer sound, then you might be able to hear.
Where the computer sound?
Share first. Then you share it.
Oh, okay.
Hmm.
Going to show you the exercises now.
Can you?
Yep. Loud and clear.
For those who are actually following the exercise, to ensure your safety, so if you're using a chair, not to use the chairs with 4 wheels. Try to ensure that
Warm-up exercise. Stationary march with arm
the
swing.
wheels on the chair.
Stand upright. Start slow marching on the spot at your own pace. Then lift your knee slightly higher. Swing your arms as you march. Each set is 1 minute, and you need to do 3 sets. If you are frail, you can also do the exercise sitting down. Sit straight and tall. Start marching, focusing on lifting your thighs off the seat.
Okay, let's start.
Stand upright. Start slow marching on the spot at your own pace. Then lift your knee slightly higher. Swing your arms as you march. "30 seconds. "45 seconds. "1 minute. Okay, let's do the second set. Stand straight again. "15 seconds. Always remember to warm up. It helps your body prepare for exercise by increasing your body temperature. It also increases blood circulation throughout your muscles, tendons, and ligaments. The stationary march with arm swing warms up the lower limb muscles and muscles around the shoulder joints. "45 seconds. Okay, 1 minute is up. Let's do the third set. Okay, start. "15 seconds. "30 seconds. "45 seconds. "1 minute. Great job! Strength exercise. Sit to stand. Sit with feet shoulder width apart with arms extended forward. Try and lean slightly forward. Stand up slowly. Pause. Then return to starting position in a controlled manner. Always look forward and maintain a straight back. 10 repetitions of this exercise is 1 set. Ideally, you should do 3 sets. Sit with feet shoulder width apart, with arms extended forward. Try and lean slightly forward. Stand up slowly. Pause. Then return to starting position in a controlled manner. Always look forward and maintain a straight back. Two. Three. 4. 5. 6. 7. 8. 9. 10. Now let's do the second set. Strength exercises help strengthen your muscles, reduce bone and muscle mass loss, and even helps with back pain. So you can carry your grandchildren or groceries more easily too. And remember, don't hold your breath during strength exercises as it can cause changes in blood pressure. Just breathe regularly. Breathe out as you push or lift. And breathe in as you relax. Also, do not lock your arms or leg joints. Lastly, do not arch your back when doing the exercises as it may strain your lower back. This particular exercise strengthens your core and thighs. 10. Now let's do the third set. 1. 2. 3. 4. 5. 6. 7. 8. 9. 10. Good job! Strength exercise. Standing hip extension. Stand with feet shoulder width apart. Hold on to a chair. Try and stay upright. Then, lift your left leg off the ground and move it towards the back. But your legs should be kept straight. Then slowly return to the starting position. 10 repetitions is one set. Switch sides. Then do another set of 10 repetitions. Stand with feet shoulder width apart. Try and stay upright. Then, lift your left leg off the ground and move it towards the back. But your legs should be kept straight. Then slowly return to the starting position. 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, let's try with the right leg. 1, 2. This exercise strengthens lower limb muscles, in particular your buttocks and hamstrings. It also helps to stretch your hip flexors after hours of sitting down. 7, 8, 9, 10. Good job! Balance exercise. Side leg raise. Stand beside the chair. You can hold on to the chair for support if you need. Keeping your left leg straight, raise it laterally towards the left side of your body. Then return to the starting position in a controlled manner. Switch sides after 10 repetitions and do a second set. Stand beside the chair. You can hold on to the chair for support if you need. Keeping your left leg straight, raise it laterally towards the left side of your body. Then return to the starting position in a controlled manner. Balance exercises help improve coordination and balance. They are especially useful in helping prevent falls. It also helps you when walking down steps or on uneven grounds. 9, 10. Okay, let's switch sides. 1. Make sure you have a sturdy chair or some support in case you feel unsteady. The side leg raise helps improve your balance by strengthening the muscles around your thighs and abdomen. 9, 10. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, let's switch sides. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Well done. Balance exercise. Single leg stand. Stand beside a chair. Lift your left knee towards the front. Try to keep your balance on a single leg for 10 seconds. Switch sides after 5 repetitions and do a second set. Stand beside a chair. Lift your left knee towards the front. Try to keep your balance on a single leg for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10. 4 more times. This exercise strengthens your ankle and ligaments and improves your balance. 7, 8, 9, 10. Catch your breath. Let's do the third rep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now for the fourth rep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The last rep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, let's switch sides. Lift your right knee towards the front. Try to keep your balance on a single leg for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. 4 more times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Catch your breath. Let's do the third rep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now for the fourth rep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The last rep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job! Flexibility exercise. Tricep stretch. Try and sit as tall as you can. Use your left hand to touch the back of your neck. With your right hand, gently pull on the left elbow to slide the palm down the middle of your back. Feel the stretch on the back of your left arm. Hold this position for about 20 seconds. Now switch sides and hold for 20 seconds again. You should do the whole exercise 2 times, each on the right and left sides. Try and sit as tall as you can. Use your left hand to touch the back of your neck. With your right hand, gently pull on the left elbow to slide the palm down the middle of your back. Feel the stretch on the back of the left arm. Hold this position for about 20 seconds. 10 seconds. 15 seconds. 20 seconds. Now, switch to your right side and hold for 20 seconds again. 10 seconds. 15 seconds. 20 seconds. Now, let's repeat the exercise one more time on both sides. Let's start. With aging, our body loses flexibility and becomes stiffer. This exercise helps increase your range of motions. It also helps you bend easily to pick up things or tie your shoelaces. But start slowly, as you can't fix it in a day. "20 seconds. Okay, let's switch sides. Do remember to not hold your breath and avoid bouncing actions when you stretch. This particular exercise increases flexibility around your shoulder and makes it easier to perform actions like reaching for your seatbelt. 20 seconds. Good job! Cool down exercise. Standing quadriceps stretch. Stand with one arm holding the chair for support. Grab your leg slightly above your ankle and lift it towards your buttocks. Your knee should point towards the floor. Hold this position for about 30 seconds. Switch sides and do the same for 30 seconds. You should repeat the exercise one more time on both sides. Stand with one arm holding the chair for support. Grab your left leg slightly above your ankle and lift it towards your buttocks. Your knee should point towards the floor. Hold this position for about 30 seconds. If you can't reach your ankle, you can use a towel. 10 seconds. 20 seconds. 30 seconds. Let's switch sides. "10 seconds. 20 seconds. 30 seconds. Good! Let's repeat the exercise one more time. This exercise stretches your thigh muscles. Cool down exercises are important as they help you gradually decrease your heart rate and reduce muscle aches after exercise. And just like the flexibility exercise, do slow, controlled stretching. 30 seconds. Let's switch to the right leg now. "10 seconds. 20 seconds. 30 seconds. We are done. Good job.
Okay, good job, everybody. Hi, Now we have come to the end of the talk. Does anyone have questions to ask me?
I think a question on the chat group. JSM is asking, is it better to take metformin before or after food?
Sorry. Metformin can be taken before or after food, but make sure you eat something after you take the medication because it will lower your blood sugar.
Thank you. And how often do we need to exercise?
The Health Promotion Board recommended we should exercise at least 30 minutes for 3 times per week. $150 for what? So you need to exercise 150 minutes per week, at least lah. So you can do more if you want. Yeah.
So you can try to actually include moderate to high intensity activities for physical activities itself. So how do we determine moderate to high intensity? Meaning that when, for example, when you are breathing, you will not be able to talk properly to full sentence itself. This is how you determine whether the exercise that you are doing is moderate or intense.
Make sure you sweat lah. That will be the most effective way to judge whether is it intensive or not.
Regarding the PowerPoint slides, I'm afraid that it's actually not for sharing. However, there's actually a recording done at Radima's Facebook. So if you would like to actually relook at the videos or the tips shared by our nurse, you can actually head over to Radima's Facebook link. We will also drop you the link at the chat box for you to actually save it down. So like what Radimas has actually mentioned is do search for Radimas constituency on the Facebook to search for their Facebook profile. I have also shared the link for the Facebook record videos in the chat box itself also. Oh, there's a reminder from Radima CC side. For those who are actually going for the lifelong learning classes, do note that tomorrow afternoon there will not be any classes on the lifelong learning.
Yeah, correct. 明天下午没有课程啊，就是早上而已。
好，谢谢。
Yes, and actually, this today will actually be our on the last topic about diabetes. So, should you have any questions regarding the diabetes, you can actually ask us before we move forward to our next topic for our health talk next week onwards.
Yeah, if there's no other question, thank you very much for joining us.
Thank you.
Thank you.
Please join us for our next health talk, which is about other topics already. Thank you.
Yeah, thank you. Thank
Okay,
you.
the next topic. That's a good question. Why not you sign up for our upcoming health talk so that you can actually take a look on what are the topics available, and then you can actually sign yourself up accordingly. Let me share the link again. And those who are on Facebook itself watching this show, if possible, do sign up and we can share you the Zoom link so that you can have more interaction with our nurses virtually, and you can have more, like, you'll be able to talk to them as well rather than putting the comment on Facebook itself. Okay. So I have already shared the link as well to sign up for our upcoming health talk. So you can take a look at our upcoming health talk there. Yep.
Okay, thank you.
Otherwise, you will see you on the 21st of June for the English health talk. If those who have signed up for the Chinese health talk as well, we will see you on the 14th of June. Thank you, Amanda.
14.
14th
Thank
of
you.
June.
Yeah, thank you. Thank you,
Thank
everybody.
you. Yeah, thank you very much.
谢谢，
Thank you
Bye.
very much. 谢谢.
Bye-bye,
Thank you very
bye-bye.
much. Bye bye. Uncle Sam, bye bye.
Uncle, thank you. Thank you.
Thank
Boy
you.
Yang.
Thank you, Uncle Kako.
Thank you. Take care. Stay safe.
Okay, bye bye. Yeah.
Bye.
Bye.
Bye.